Guided Notes 4.5, Disease. Learning target, I can describe the different ways disease spreads and impacts the human body. As you watch, please remember you have the ability to pause, rewind, and you should always take notes as you go. Disease is defined as any change, but not injury, that disrupts the normal function of the body. So an example of an injury would be a cut, a broken bone. Those are not examples of diseases. Things that cause disease can be pathogens, such as bacteria, viruses, fungi, protists, different factors in our environment, like smoke or radiation, and DNA mutations, or changes in our DNA. A pathogen is a microorganism that causes disease. Again, it could be a bacteria, a virus, a protist. We classify diseases as infectious if they can spread from one person to another. If they cannot do that, they are not infectious. So when we talk about our different types of pathogens, they cause different types of disease. For example, viruses or bacteria can destroy our cells. Bacteria can also release toxins that make us sick. Parasites can block blood flow or remove nutrients from us. Examples of pathogens, viruses, cold, flu, smallpox, coronavirus. Bacterial pathogens are strep throat, anthrax. So if you've ever had strep throat, it's actually a bacterial infection in your throat. If you've had an earache, it's typically a bacterial infection in your ear canal. If you've ever had athlete's foot or ringworm, that's an example of a fungi. Less common here in the States, but also types of pathogens are tapeworm and hookworm, and protists, which are these single-cell organisms that cause malaria or amoebic dysentery, are also examples of pathogens. There are three main ways infectious disease spread. So physical contact or through the air, through contaminated food or water, or through other infected animals. We often prevent infectious disease transmission by washing our hands, covering our cough or sneeze, making sure that our food is cooked well, and keeping good sanitation. Immunity is the ability to resist a specific pathogen. When we talk about immunity, we have three lines of defense in our immune system. The first line of defense is to keep our pathogens out. It's non-specific, meaning that it's going to work for almost all of them. Examples of this would be our skin, tears in our eyes, wax in our ears, acid in our stomach. So for example, when we eat something, right, the acid in our stomach, if it's something that could harm us, is most likely going to kill that. Example with our skin, if we touch some type of bacteria, as long as we don't ingest it and actually put it into our body, our skin is going to help to keep that bacteria out. The second line of defense, his purpose is to attack or kill pathogens that actually enter our body. Again, this is a non-specific form of defense. Examples here would be our white blood cells and phagocytes, two examples of cells in our body that help to keep us safe. The third line of defense is a chemical defense, also known as antibodies. This is very specific. There is a specific lock and key structure where the antibody has to fit right in order to be able to protect and defend our bodies against that specific pathogen. Here we have lymphocytes, and there are two main types, T cells and B cells. Again, both of these are very, very specific in their defense. When we think about our lines of defense, our first line of defense, again, an example would be a skin. Think of it as a very broad defense line, right? Like a fence would be around a house. Second line of defense, also non-specific. You can think about that as foot soldiers. Third line of defense, very, very specific. Think of that as a special forces operation going in to target one specific thing. Immunity is very important to us. We get immunity in different ways. It can be either active or passive in its transmission to us. Active immunity typically comes from having the illness or receiving some type of vaccine. A vaccine is a weakened or dead form of the virus that stimulates an immune response. This allows our bodies to go and remember how to fight off this particular virus. So next time our bodies come in contact with it, we know how to fight it and we don't get typically as sick. This is often seen with the flu, right? Each year you get a flu vaccine and hopefully then you are not super sick if you ever get exposed to that virus. Opposite to active immunity would be passive immunity. This is typically in the form of antibodies, again, very specific, that are transferred from one person to another. An example of this would be a mother nursing her baby. The mother's antibodies are going to pass from her into the baby, helping to protect that baby. When we talk about medicines that help to keep us safe, there are different ones depending on the pathogen that causes the illness. For example, vaccines are for viruses. We typically use them before we get sick. Again, they are a weakened or dead part. They stimulate your immune system so it learns and knows how to fight off that virus the next time you come in contact with it. And most of the time, it's going to build that immunity without actually causing the disease in your body. Typically, antibiotics are used to treat bacterial infections. Anti meaning against. We typically take our antibiotics after we get sick. It's very important that you take all of your antibiotics when you are prescribed them, so that way you kill all of the bacterial infection in your body. If not, there have been some cases where bacteria can then mutate or change, and this creates a superbug, which is very difficult to kill and can cause a lot of damage to people. Antifungals, again, anti meaning against. We use these typically after we get sick. Antifungals treat fungal infections, and antivirals we typically use to help decrease how often viruses reproduce in our body, giving our immune systems a better chance to fight off that viral infection.